Hello, this is Dr. John Raymond Baker of Baker Chiropractic. I'm a chiropractic doctor in Longview. And on this video, I wanted to talk a little bit about the difference between chiropractic as a philosophy and a healthcare system and the allopathic system, or the system that's practiced by MDs. Basically, if you look at the history of medicine, especially in the Western world, a lot of healthcare practitioners want to trace their lineage back to a gentleman named Hippocrates. You might have heard of the Hippocratic Oath. There was basically two schools in ancient Greece. There was the Hippocratic tradition with Hippocrates of Kos, C-O-S, and then there was the Cnidian school, C-N-I-D-I-A-N. Now the Cnidian school and the Hippocratic school had two different philosophies about how the body develops disease. The Hippocrates faction said that your body is responsible for staying healthy, and if you get sick, it's because of a failure of your body to fight off these bad things that happen to it. The Cnidian school said no, basically disease comes, just attacks you and takes you over. So it sounds like, that these are kind of minor differences. However, it led to a very big difference in the place of the healthcare provider in these different systems. In the Hippocrates of Kos school, the patient was central. He or she played an active part in their health. In other words, you had to keep yourself healthy, healthy in mind and body, because if you didn't, you became sick. The Cnidians thought, no. The patient really has no place in this issue. We're the people on the white charger that come in and fight disease heroically. And actually, the allopathic system is more aligned with the Cnidian school than they are the Hippocratic school, because they do take this notion of the heroic doctor in white fighting your disease, and the patient is just the battleground on which this grandiose battle occurs. The chiropractic method basically stresses, as Hippocrates did, that it's the body's innate tendency to heal itself. When it doesn't heal itself, when it doesn't fight off infection, that's because of the failure of the internal milieu. The internal environment has failed to properly defend itself. And the place of the healthcare provider is not to be some superhero dressed in a white cloak and battling disease on the battlefield of the human body. It's basically to remove impediments so the body can heal itself. And we know that if the body doesn't heal itself, there's no medicine, there's no therapeutic procedure from allopathic, there's no surgery that's going to fix it or make it heal itself. If there were, then there wouldn't be folks dying with AIDS, because AIDS is basically an immunological situation where the body is not able to fight off different cancers, different infections, so-called opportunistic infection or opportunistic cancers. So, it sounds like I'm coming down with a cold. But the point is that in one camp, in one school of thought, the patient is an active participant in his or her health. In the other, you're basically seeing it as a disease with legs that carries it around, and the battle is between the great doctor and the disease. And so I'm more happy to be aligned with Hippocrates of Kos, and in a subsequent video we're going to talk about the prevention-based care that chiropractic stresses and Hippocrates stressed. Thanks for watching this part one of this video series, a kind of a mini-series. And I hope it's been enlightening, and I'll talk to you more later on the second video. Thank you. Bye-bye.